Folks, we're back. I'm your host, BKP. We're at Circuit World here in Blue Ridge. It's now time for Ask the Doc with Dr. William Whaley, Georgia Cancer Research Center, affiliated with Northside Hospital. We appreciate them bringing this segment. Now, I get the questions. I get them in the email, so when they send them to you, I get a co-copy of the questions. So I get them at the same time you do. And I get the questions, I look, and I say, well, no way I'm touching this one. I said, I cannot wait for Friday. I just have anticipated and have waited. I said, I can't wait for Friday to see Dr. Whaley work his magic through this question. So let's go with it, okay?
You don't want to ask about my tie?
Oh, well, yes. Okay, about your tie. I'm sorry.
All right.
I apologize.
I did tell you that you already heard it, but this is my tie. This is my Pence Trump tie for them coming to our state. If you stop and think about it, we have 50 states. There are a lot of races going on. You've had the vice president here 3 times, as I recall. I was asking my guys in Dalton and my guys that know Trump, like Pete Petito, you're going to get Trump here? Well, I'm not so sure whether he'll be able to come or not. I mean, if he packed up his bag and he's coming to Georgia, and Pence has already been here 3 times, this election for governor of this state, the other ones are important, but the governor of this state is a national huge hook. And everybody needs to get out and vote. You can vote till 5 o'clock or 4:30 today, I think, here in Fannin
today's
County.
The last day of early voting.
Last day of early voting. It's not, the records have been broken. It's going to be sunny this afternoon, I think.
Yes.
Go vote. It's much more important than hearing me talk about stress. All right, go ahead. You can ask a question about stress now. I just want to get.
No. I'm sorry. I know we always open up with something, but I've been so anxious to hear you try to explain this, and I know you'll do a great job with it. It's just the way the question is written. How should women manage stress? We're all waiting to hear this one, Dr. Whaley.
All right. Well, first of all.
Well, maybe I'm in trouble here. I might have gotten in trouble.
No, you're not in trouble at all. I'm going to interpret the question that it's a serious question and not a joke.
It is. It is a serious question.
And second, that it's written by a woman. Now, if you're going to define stress, people joke about stress a lot. I think that the life is stressful. You know, life isn't fair.
Right.
Definitely not fair, and it's not stressful. So I'm gonna pull out what's going to be the third thing we're going to put up here in a minute, and I want to say that the risk factors. I want you to listen to this carefully. The risk factors for acute stress disorder. Now, that's not worrying about your paycheck, which is, that's day in, day out life. That's not that's not worrying about your kid who's failing, or that's not worried about whether or not your marriage is going to break up. That's not stress. That's life. Okay? Acute stress disorder is a real disease that occurs in 5 to 20% of people who suffer trauma that I'm getting ready to talk about in a minute, and is the antecedent to what we think of when we think about stress, which is post-traumatic stress disorder. So there are 2 different stress characteristics of a real stress disorder: the acute stress disorder, post-traumatic stress disorder. Now, obviously, acute stress disorder is much more common than post-traumatic stress disorder. So when you go to look for the risk factors, if you just look at the risk factors, what is one of the biggest risk factors? Now I'll let you read it even without your glasses. I'm holding there.
Female gender.
Female gender. So the question was asked, how do you suggest that women handle stress? The fact that it was written by a woman is just in concert with the predispositions of who gets an acute stress disorder. Show Lou Holtz. This is basically the truth of the matter, and it says it's not the load that breaks you down, it's the way you carry it. One of my favorite statements that I gave to my children was Fido, and you and I have discussed this about 2 years ago. There was a Marine blown out of a foxhole in Vietnam, put in a body bag, and was in a stack of body bags to be taken off to the ship. And a corpsman noticed that the body bag was moving, and he opened it up, and this guy had side of his face was gone. His whole left-hand side was blown up, and he had been pronounced dead. Well, this guy lived. He had to have a steel plate put in his head. He had a glass eye. He had all of his limbs fixed like you do today, and he became a motivational Christian speaker. And he drove a camper all around the country. And I first heard him on Crystal, whatever that was, the big Christian television program. What was that guy's name? I've forgotten now. Anyway, so his license tag was Fido.
The Crystal Cathedral.
Crystal Cathedral. Okay.
Yes.
Whatever his name was.
Yes.
You got it. Yeah, see, we're digging deep, aren't we?
Yes, we are.
All right.
Robert Schuller.
Schuller.
I know I get it.
He gave the sermon in Schuller's church one time, and so I got the video of it. I got about 20 copies. I gave it to all of my kids, and that's been, 35 years ago. And they still talk about Fido. Fido was his life motto: forget it, drive on. And he said, when you go into the hospital and you see a woman and she starts telling you about how bad the labor was, you said, lady, I don't want to see the labor, forget it, Fido, let me see the baby. So if you read Lou Holtz's summary there, it's not the stress that gets you, it's the way you carry it. So here are the precipitating factors for acute stress disorder in order of magnitude. The acute stress event that then will lead to acute stress disorder, and traumatic motor vehicle accidents are the biggest. It's around 13 to 20%. Second is something that would cause traumatic brain injury. That's like an IED or getting hit in the head with a baseball. Third is physical assault. That'd be like being robbed or somebody break into your house. Next is a burn, and that means a pathological burn where you go to the hospital and have skin grafts or something of that sort. Industrial accidents, the scaffolding collapses, somebody breaks his hip, not you. Now these are people who witness it or have it happen to them, but they're not particularly injured themselves. Or being witness to a mass shooting. 33% of people with acute stress disorder would have been the people that were in that school last week or in that synagogue last week who witnessed other people being shot. All right, so now you've got these traumatic events. So these are different loads, as Lou Holtz says there. Now here are those risk factors we pulled out a minute ago, where female gender is one of the risk factors. The second risk factor is how severe was the trauma. Second is, have you had prior traumatic experience? And the biggest one is, have you had pre-trauma psychiatric type behaviors? Being neurotic, being depressed, being anxious. Well, all three of those behaviors are more common in women, right? So, if you set up for acute stress disorder, you then witness the gunshot wound or the big time trauma or something, but it has to be to meet the diagnosis of acute stress disorder. Each one of those things under the new ICD thing has an independent diagnosis, so that you're able to really follow data now when an acute stress disorder diagnosis is made in a medical environment. And if somebody has had one of those events and begins having these avoidance behaviors, flashbacks, and all of those sort of things, beginning usually 3 or 4 days. In other words, everybody is going to be bummed for the first 3 or 4 days, but you begin to cope. And after the first 3 or 4 days, going out to a month, if these various manifestations of stress, you get flashbacks, you're waking up at night, you carry it out into other environments. Let's say that you got somebody rob you at gunpoint, and then you start having these things, these other things coming at you, and you're dreaming all these bad dreams and stuff. That then again be acute stress disorder. Now show that pretty sign. We're going to leave that up for a while, but you got this nice pretty chart here of things you can do that would help you manage stress. And this is the answer, actually, to the question as it was asked. Prior to going to a doctor, you must recognize that you have a pathological, overwhelming, different from your peers' reaction to this sort of stress. Now, as I said, I broke the percentages out where the mass shooting was 33 and the traffic, big time traffic, this is seeing them, would be 20%. And people who who have this disorder not related to a single event generally are EMTs who in a major trauma or say car wreck have to pick up body parts, and then 2 weeks later they got another big car wreck and they got to pick up body parts, or police, sheriffs and so forth, who repeatedly are seeing child abuse or repeatedly seeing domestic violence and people getting shot and stuff. But that's the minority, ones that have repeated episodes like that. So anyway, now we're back to what do you do if you realize that you are having an exaggerated response to a stressful event. And if you look at that chart, go on and look at that chart, you'll notice in there's exercise in there. We always come back to exercise, and this is the only thing I can remember that we've asked in a long time. It doesn't say weight has something to do with it. Okay, so one is you start trying to manage your time. 2, physical activity creates that hormone I mentioned before when we were talking about addiction called endorphin, and that lowers stress. Used to be when I used to box some as a younger man, if I was upset about something, I'd go down, I think it said this a few weeks ago, I'd go down and punch a speed bag for about 5 minutes. Punching a speed bag for 5 minutes was better than anything else for me. Then when I got to running, going out and running would do it. Okay, another would be music. People go yoga or meditation. You go to a prayer group. You have the prayer group meet with you, people that you trust with, and they pray with you together, and that sort of thing. And you have to seek out the group of people that you get along with, that we call that social support, and let them reflect with you on, yeah, this was horrible, that car wreck and so forth. I'm trying to help you work through that. But the thing that you must absolutely avoid is alcohol, any kind of drugs that sedate you and blunt the reaction. You have to work yourself through grief and work yourself through this stress to get it fixed. Otherwise, you're putting a Band-Aid on it, and it's going to keep coming back, coming back. Now, when do you go to a professional and have him refer you to biofeedback, meaning you go see Ray Tidman first, and then he's going to send you to a psychologist or a counselor or something or other. But the actual treatments are not medicines. You've heard us talk before about biofeedback. What's biofeedback? Well, a lie detector measures your heart rate, your skin resistance, your respiratory rate, and then they ask you, did you steal that stuff, or what? How old are you? Where'd you go to high school? And then did you steal something? And your reactions are different. Well, they can use biofeedback to help you block some of these stress reactions. So after this has gone on for a month, then it's time to go do something, and it is almost never that includes medication. So I didn't want to go beyond, I didn't want to go crazy with this question, but I am of the opinion that whoever asked it's serious. Second, they were female, and females have a much harder time dealing with acute stress disorders. And I don't know why, and I've got about 30 pages over there that I read. I mean, I really spent a lot of time on this question. There's not a real good reason for females to have a harder time dealing with stress, except for the fact that they have an increased incidence of those psychiatric disorders. I think it's got to do with role. That females are, they're supposed to take care of the kids, and if their husband's a jerk, they're supposed to get along with it, and they're sort of, I don't say a suppressed or whatever. I mean, Lord knows, but I think they just have a harder time in life. That guys do have a leg up over them, and whatever, and maybe men have had more athletics, or they've had more military training, and they've had more pain, or they've had more disappointments. But in any event, I think the person who wrote the question was serious. I didn't want to diminish the question, but what I wanted to encourage them was that it's uncommon to get this severe and with a major trauma. It's somewhere between 5 and 20% of people who have one of those traumas who develop the acute stress disorder. And the acute stress disorder goes into post-traumatic stress disorder less than 5%. So first of all, there's light at the end of the tunnel, as Lou Holt says. Second, to get to the light at the end of the tunnel is to recognize that you've got it. Don't go to the trying to get tranquilizers or alcohol. Recognize it. Be like a broken bone. That broken bone's got to heal. You've got to go through rehab and get back to normal. Particularly if you have muscle wasting, then you've got to go to physical therapy. So you've got to go to mental therapy. I would say that with my wife, Jane, it would begin with her prayer group, with a guy who's got a bunch of friends in a fraternity or fishing or poker buddies. It might begin there. But anyway, I didn't want to get on my high horse, but that's enough. You got a question about it?
No, I'm good.
You good?
I'm good.
You good?
I like
there,
that.
Huh,
I like the music.
You like the music one?
Yeah, that's
you like the exercise one?
No.
Okay. You like the yoga one, okay, though?
No.
No.
I like the music.
You like the nature one where you go?
Where did you miss? I like
the music. I like the music. I like the music too.
No, really.
That, by the way,
my music. I will get music on a Friday night. Okay. On a Friday night, Saturday night, I'll get music outside if it's warm by myself at Cheap Cigar. And just that's what I like.
All right, I don't like to take this into personal stuff, but the encephalitis I had in Vietnam had a 50% fatality rate, and I got shot at only one time. But both of those are sort of stressful sort of things. So, people like me, I don't worry about the fact that the washing machine overflowed, or that there's been an accident if nobody's been hurt. And it's kind of hard to be married to somebody like that. But back in the day in the several years when I was still with Marine reservists and was after the Vietnam time, if I felt out of sorts, I had known and been treating the Allman Brothers, and by then I knew Gary Morris. I would put on earphones with Gary Morris, who's a great singer. I'd get me a tall iced tea glass and fill it up with ice, and then I'd pour some brown whiskey in it. I'd spend 4 or 5 hours just sipping that big iced tea glass and listening to that stuff and lying on the floor in my living room. I'm coming back from and listening to the music and just cooling out.
I say, it's not the end of the world, because you know what the end of the world is? End of the world. So no matter what it is, it's not the end of the world.
That's right.
So, all right, now let's get on to our next one. This is something that I've heard discussed many times in the past, and people have talked about. This is when I got the question. It's not the first time I've looked at this and thought about it myself. Does cutting into cancer make it spread?
Well, what you'll remember last week when we were talking about breast cancer, I put up a thing on breast cancer myths. So this is a myth. Quite obviously, if you have a cancer and you take a knife and stick it in the middle of it, make a slice out of it, the answer is yes, it could help it spread. But the answer to the question is basically no. First of all, surgical techniques don't touch the cancer. They come around it from the outside. Second, diagnosing a spot deep in the lung or deep in the abdomen or deep in the mediastinum is most safely done by either endoscopic biopsy or needle biopsy under CT scanning technique, which is not cutting into it and sticking the needle in the middle of it and sucking out cells and then pulling the needle out. And in theory, you would think that could seed the needle track. But if you take the hazard-benefit ratio of the hazard of an open biopsy versus the needle, or you take recurrence rates and life expectancies, those diagnostic procedures are not associated with any harmful outcome in terms of disease-free survival or overall survival or recurrence rates. So the second part of that question is, well, when you go into a cancer, the oxygen in the air when you take it out makes it grow. That again is a myth. As you're doing the surgery, there's no more oxygen. The oxygen in the air is the same as the oxygen in the blood. And so that tumor's got the same amount of oxygen in your body as it does when they open it up and remove it. So there's no concept about that. The third is that sweets or sugar feeds the cancer, and if I just go on a real low carbohydrate diet and lose a bunch of, lose weight and get skinny and follow a holistic diet, that it's going to change the growth characteristics of the cancer, that also is fallacious. So those are all part of the same myth. Sticking a needle in it's going to make it spread. Operating on it is cutting into it, which it's not. And so I call that question part of the cancer myth about diagnostic and therapeutic surgical procedures.
Thank you very much. We want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. And before we go, is there anything in the out there in the medical field or out there going on that we need to know about?
I think you're going to hear it in the news today or tomorrow. I was a witness about 35 years ago in a large lawsuit against the Southern Company for lymphoma and brain cancer in people who lived in houses that were underneath the high-power tension lines. Electromagnetic force as a cause of cancer or leukemia or lymphoma. And there is some evidence that airline pilots who fly global routes above 35,000 feet might get enough radiation through the skin of the airplane from atomic particles to have a slightly higher incidence of brain cancer. So my wife said, always come back to my wife, these cell phones are causing brain cancer. You will hear today, or probably today, that there was a study that began under the Clinton administration. So you've got to go back in time. That involved, I think, 7,000 or 70,000 rats. And exposed those rats to the amount of cell phone energy in the first generation of cell phones. And now, after 20-something years, there is a minor increase in the amount of brain cancer in those rats. Before you can take your cell phone and throw it away, you need to know that the amount of radiation that came out of the first cell phone was in a totally different frequency and a different amount than what you have today. And so today's cell phone can't be compared to that one. My first cell phone was bigger than a car battery, had a big old handset on it that looked like something out of World War II, and I'd put it below my seat at the Hawks games. So, yes, you probably ought to use a headset if you're on the phone 6 hours a day as part of your job. If you're talking on the cell phone as much as I am, you don't need to worry about it. I got a thing the other day said my total screen time from on the telephone, on the IP, and talking was 52 minutes in a week. I imagine you probably got 6 hours in a day. So that's number one. Don't panic when you see that released here in the next couple of days. And the other one that you're going to see that's kind of funny is that if your appendix have been taken out, you have a 22% less chance of getting Parkinson's disease than if your appendix is in. And you've always been told in school the appendix is a vestigial organ that has no effect. Well, if it has any effect, and that's true, it may be a harmful effect. And again, this is a very, very unscientific preliminary study, and I don't rush out and get your appendix taken out just because you're trying to prevent yourself from getting Parkinson's.
I didn't rush out and get my appendix taken out. It felt like something was tearing inside of me.
Yes,
so
correct.
For those out there, I've just said I don't have.
Right, now, have you already heard either of those two things yet?
No.
Okay, well, you will in the next day or two, probably.
I'm missing a gallbladder and an appendix. I need everything else. I gotta have everything else.
Yeah. You can give up a few wisdom teeth, and after that,
after that, it's it.
Yeah, that's it. You don't have anything else.
Dr. Whaley, appreciate it. We want to really say how much we appreciate Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. If you have a question for the doctor, you send it to info at fetchernews.com. In the subject line, put Ask the Doc and send us a question. We'll get it over to Dr. William Whaley. We appreciate you very much, sir. Thank you for all the research you do. He did mention how many pages he reads on several of these questions just to make sure he's up to the most up-to-date studies on these. And he does. He really does. Covers them all. We want to thank you very much. We're going to take a break, and then it's time for the All-Star Political Panel. And if you haven't heard, there's an election going on, so we might talk about it. Back right after these messages.